Welcome, March 2023. My name is Robert Tasker and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. My three Editor's Choice articles for this month are: first, what about corticosteroids in septic shock? Cloak et al. Do an analysis in 500 children who have been divided by persevere biomarker categories. And the authors have looked at the interaction between steroid use, persevere category, and outcome. There's an accompanying editorial with an overview of biomarkers in septic shock, 2009 to 2021. It covers precision medicine, endotypes, and the future randomized controlled trial. My second article is about outcomes after cardiac surgery. Brown et al. From the UK look at 400 children and quality of life at 6 months post-surgery, and look at various mediation and mitigation factors that may influence the dynamic of outcome within the family. If you haven't read it, do also look at the 2022 article in Archives of Disease in Childhood by the same authors. The third article is about near-infrared in the cardiac surgical population. It's by Iliopoulos et al. And it examines the validity of this investigation. You'll be surprised by the findings. Clearly NIRS is here to stay, and there's an interesting editorial that accompanies this. Also, just as a historical note, Britton Chance, the National Medal of Science winner in 1974, actually wrote to PCCM in January 2006 on a similar theme. So look at all of those. Then lastly, I have two themes in the PCCM connections for readers. First, I sort of give you an overview of the material that we have on the endothelial glycocalyx. We've previously looked at vascular permeability, we've looked at cardiopulmonary bypass, and now there's an article from Columbia about sepsis with an accompanying editorial. The other theme in PCCM connections is hyperoxia and morbidity and mortality. This is a topic that's not going away. You may have seen the JAMA Open Network article. We learned that there were 16 studies in over 27,000 patients. Now we see in PCCM a mechanistic study looking at redox state from the oxy-PICU cohort. Finally, we have another narrative essay, and this is called Trip of a Lifetime. So, thank you very much for being readers, and I hope you enjoy this month's content. Goodbye.